Hello and welcome to the Idaho Reports podcast. I'm Logan Finney. Joining us this week is freshman Senator Camille Blaylock from Caldwell. Thanks so much for joining us.
Yes, thank you, Logan, for having me. It's great to be here.
So we try and do these every session or so, introduce a new freshman lawmaker to our audience. Can you talk to me about your district and why you wanted to run for office?
Sure. So I represent District 11, that's out in Caldwell. It used to be more of the countryside of Caldwell, but since redistricting, it's more of that downtown area. We still have some of the agribusiness groups in that district. But a little bit about me, I'm born and raised here, grew up over in Nampa. My husband and I bought a home over in Caldwell, 13 years ago, I think. We've moved a couple times, but always within Caldwell. That definitely is our home and our community. We love it there. We have 2 kids. They go to a charter school out in Caldwell. And again, we just love that community. I think you asked why I ran. I have been asking myself the same thing. No, I'm just teasing. No, I grew up in a family that was very active in the community. My parents both just were great examples of serving within your community, within the state, serving within your church. And so I just have always grown up watching them give of their time and their talents to just service. The last, I've worked in the private sector for the last 20 years, and recently that had slowed down on some fronts, and so timing was right, and just thought, hey, this is something I should do for Caldwell, to be able to go and represent the place that I love so much, and so I decided to throw my hat in the ring, and here I am.
Yeah, we're about a month and a half into the legislative session now. I don't know if that's a 50% mark or not, but sometimes it is. How has this first couple months met your expectations or surprised you?
It has been a learning experience. This is kind of the legislature here. It's like this whole ecosystem that kind of feeds itself. And then you go home and you're like, oh, real life, but you come here and it's a lot of information and it's important. It's totally outside of what I was expecting. But I'm grateful to be a part of it and be able to just, bring my perspective, to the different things that we look at, whether it's rules or now we're starting to look more at legislation and laws. But yeah, I would say it has been an interesting experience. I don't know. I don't know if there's been anything that's been, I don't know what my expectations maybe were, but it's been a great experience.
You also ran, I believe, your first piece of legislation last week had to do with testing for newborns. Can you talk to me about that bill?
So I actually ran 2 last week. One of them was helping the Department of Health and Welfare. They have a new director over there who is very motivated to get rid of rules that have been sitting for a long time. One of those being the newborn required tests. So these are tests that we do on newborns in Idaho today. These rules are enforced as if they are law. And so moving rules that have been in place, those ones specifically have been there since 1921, I think. Oh, wow. So over 100 years. I think we can say that those rules are stable. Move them into statute where they belong, because again, these are enforced as if they are laws. And so putting those, where elected officials have oversight rather than in a department with unelected agency staff that could change those if they wanted. And again, these are enforced as if they're law. So moving those into code, that was that one. It doesn't, the title of it maybe sounds more ominous than it really is. This is exactly what happens today when a baby's born in Idaho. The other one deals with hospitals and medical clinics within the state that bill Medicaid and Medicare. So those are federal programs ran at the federal level by CMS. CMS requires a lot of, they have a lot of rules and you have to follow all of them, a lot of reporting, a lot of requirements. So the bill that I passed basically says if you're a healthcare provider and you're meeting CMS standards, we consider you good in Idaho. So we will license you, but we don't require anything additional. So that bill removed 19 sections of Idaho code and 123 pages of agency rules, and just kind of eased up that burden that we've put on a lot of our healthcare providers.
The assumption being if they're meeting these federal standards,
Yep.
by definition, they're meeting what Idaho was requiring.
Correct. And I don't want to say, I hate to use the term gold standard when it comes to anything that the feds do. But exactly, if they're meeting that high level of regulation that CMS is requiring, then there's nothing more we would ask of you here at the state.
I don't remember if it was the hospitals bill or the newborn bill, but one of them you got to experience a little bit of hazing on the Senate floor. Is that right? Can you tell me about that?
Yes. So it was the newborn bill, which again, it was titled Newborn Required Testing. That was how they titled it. So you can imagine that I personally got a bunch of emails. What is this? Why are we testing babies? And I had to tell people, this is nothing new. We've done this for 100 years. It is a way to catch early detection of diseases, right? I would dare say that anybody in Idaho today that was born in Idaho, you had this done. So I get on the floor and I present this easy bill. We're moving a rule into code, and I close debate, and then they started voting, and the first few people started voting no, and my heart just sunk because I was like, oh dear, I didn't lobby this hard enough. They must be getting the same emails and have concerns, and I didn't take the time to go talk with everyone. But it got to a couple people that I know well on the Senate floor that are friends, and they voted no, and that's what alerted me that maybe something was up. I was like, there's no way that they would vote no on a bill without at least giving me a heads up. So yes, you're right. I would say almost all of the senators on the floor voted no. And then before the vote count was announced, they would stand up one at a time and switch their vote, and it ended up passing unanimously.
It's a little bit of a quicker process in the House where they just have their buttons on their desk.
Yeah, in the Senate, you have to stand up and ask the president, to change the vote, and it's a whole ordeal. And it was great. I mean, it was friendly, and I understand now that for the first freshman on the Senate side presenting a bill, that's typically what they do. So lucky me, I guess.
Well, you've been initiated now.
Yeah, there we go.
As we're looking ahead to the next several weeks, what big ticket issues are you expecting to come up?
Well, there's a lot going on, and I've learned that not everything that is printed necessarily gets hearings. So just kind of understanding what should I spend my time really digging into, and what will I actually be voting on or debating. But for me, I do have one more bill that will be up for a hearing next week, and that has to do with assisted living communities within our state, which this is kind of a heartstring issue for me, so one that I'm excited to represent, but just making it easier for those communities that take care of our aging population, making it easier for them to not only open in the state, but operate and operate well and take care of our elderly, especially as we have more people aging into needing more higher care.
Yeah, we are certainly a state with an aging population.
Yes, yep.
You're also one of the senators who's coordinating the memorial service that's happening this year. Can you talk to me about that and getting assigned that duty?
Yeah, so again, another thing that I think they give to freshmen typically. So Senator Woodward, who sits right next to me on the floor, him and I were both asked to host the memorial service. I guess this happens every year in the Senate, and it memorializes any of the senators that have served that had passed away in the last year, 2024. So we will have a service on, I think it falls on President's Day, which is the 17th. we kind of split up the responsibilities. Jim is going to run the show day of, and I helped plan some of the people coming in. So I actually have my nieces who have angelic voices. They're going to come do a musical number, and then I have my brother-in-law is stationed in Mountain Home, and is going to come in and do the indication. And so, so kind of making it personal, but also honoring the people that have served and that have passed away.
All right. Well, is there anything you feel like our audience should be aware of as we're keeping an eye on hopefully getting towards Sine Die in the next couple months?
Anything that they should be aware of? I would say I am pleasantly surprised about how accessible all legislators are. I know for me personally and the other legislators that am close, our offices are close, so we're chatting about administrative things. We all stay on top of our emails. We have secretaries and staff that help out with things and keep tallies of phone calls for where people are leaning on certain legislation. So I would say if you see something, a bill that's coming through and you have a strong opinion of where you want that to go, call your legislator, whether you talk to them on the phone or send them an email, but make your voice be heard, because I genuinely do hear all of it, and I appreciate it so much because it's a nice way to just gauge where people are at on things.
All right. Senator Camille Blaylock of Caldwell, thanks for your time this morning.
Thank you so much. I appreciate it.
Programming support is provided by the Idaho Humanities Council, deepening understanding of the shared human experience by connecting people with ideas and local public programs exploring history, law, literature, and citizenship through the humanities.
Presentation of Idaho Reports on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore and Bettis family legacy of building the great state of Idaho, by the Friends of Idaho Public Television, and by the Corporation for Public Broadcasting.